Is there sexual bias in the study and treatment of cardiovascular disease? The facts, as explored in a recent multi-center study, certainly tempt us toward that conclusion. Some cardiovascular problems are treated more aggressively in men than in women, and these differences cannot be explained by gender-related differences in disease prevalence. Part of the problem may be the long-held belief that if we compare men and women at the same level of hypertension, women have a far better prognosis than men. To an extent, this is true. The Framingham study showed that among men and women of the same level of arterial pressure, women had a 66% lower risk of stroke, a 50% lower risk of developing coronary artery disease or congestive heart failure, and a 33% lower risk of sudden death. A recent study shows that men and women of the same age and same blood pressure have very different cardiovascular profiles. Increases in arterial and pulse pressure induced by isometric stress were almost 50% higher in men than in women. And for any given level of blood pressure, women had a lower total peripheral resistance than men of the same age. But what happens to these cardiovascular differences between men and women once women reach menopause? In a moment, we'll look at the answer, which could affect the way you treat hypertension. Today's programming is sponsored by Marion Merrill Dow, makers of Cardizem CD, diltiazem hydrochloride.